It will say record in the corner. I do that. Yes. So welcome, Wandile, to this interview with Global Aktion. We have asked and asking a number of our friends and comrades and partners in the Global South about how the corona virus have infected their work as activists, but also their private life and the people living in their country's life. This is also the case with you. Just to present you, you are the coordinator of Swaziland United Democratic Front. It's an umbrella body for pro-democratic movements in Swaziland who want a democratic constitution with a democratic elected government who have the responsibility for the running of the country and get away with the absolute monarchy that you have at the moment. So welcome, Wandile.
Thank you very much, Comrade Morten.
So the first question I have for you is, how have the coronavirus infected the political movement of the pro-democratic movement in Swaziland? What have been the challenges for you?
It's now almost a month that in Swaziland it's been officially announced that the COVID-19 casualties, if we want to call it that, has affected the community or the nation of Swaziland. It has sort of frozen us in terms of almost all our activities. We had to go on a lockdown that was announced by the Prime Minister on the commandment of the King under what is called the National Disaster Emergency Act of the year 2001. They invoked one article there which sort of declares a state of disaster, but is as good as a state of emergency. That literally means you must be behind doors, at your homes. You are not supposed to go out. You are literally 24 hours supposed to be grounded in your homes. So as a movement that is in constant contact with our members as well as members of society, we had to collapse all those types of activities. And it has sort of brought a lot of uncertainty, anxiety, and frustrations, especially among the poor and vulnerable of our people.
Yeah, because if you are forced to be inside or be behind locked doors, how are people surviving? I'm thinking about poor folks, who have no money on their bank account, who have a fridge packed with food. How do they get through this weeks?
It's been very, very tough for the ordinary Swazis who make up at least 62% of the poor. You will know that Swazis have 62% of Swazis live on less than $1 per day. And these are the people who literally scavenge for a living, in the sense that they do not have enough food for a week. They do not have enough food for 3 days. They always mobilize through their informal economy activities, enough food for a day. So if government now comes up and says, you must be behind, you must be indoor, and soldiers and police are deployed on the streets to patrol the rural community, the urban and peri-urban, which literally forces people to be behind doors and run out of the food for a day. That has really caused a lot of trouble, because they have no options. You will, as early as like yesterday, the government, the Minister of Health reported that there were 7 new COVID-19 cases, taking it to 31. That currently the country has 31 people confirmed to be positive with coronavirus. That is out of plus minus 1,500 Swazis who have been tested for the past 3 to 4 to 5 weeks of the official COVID-19 lockdown period. So these are ordinary Swazis who, first and foremost, their biggest struggle is how to survive. And now they are subjected to a street movement or lockdown arrangement without a program that meets out their daily food, water, and basic needs. So it has sort of thrown them under the bus, if I were to put it that way, in a big way.
Because the border to South Africa is closed, and Swaziland, being completely depending on imports from South Africa, must suffer quite a lot on this. What is the situation at the border? Is there any travel over the border?
Yes, the president of South Africa announced again more or less 4 weeks ago that they are locking down all borders. Literally, all borders are closed. No one is coming out, no one is coming in. And me and you will know through the work that we do that out of the 1.4 million Swazis, which is the official population by the last statistics conducted by government, almost 250 to 300,000 Swazis go to South Africa as economic exiles, if we want to call it that, meaning they do go into the mines, they go into the many informal spaces of economy in South Africa. That's where they get their source of livelihood. So if you lock the borders, you can as well imagine how a dark pit hole you are throwing those ordinary Swazis.
Yeah, I can imagine. So you had relatively few people who have been infected, but how is the health service or hospitals in Swaziland prepared for such a virus?
Yeah, Comrade Morten, you know, I just yesterday, because we are in constant communication with the Nurses Union, the Swaziland Democratic Nurses Union, otherwise commonly known as SWAT, I was talking with one of their leaders who keeps briefing us on a weekly basis about the state of things. And as SUDF, we have been, even before the COVID, had been in constant close working relation all along. The update that they were giving us was there is a crisis, a health crisis generally in Swaziland, which emanates out of one, there is a chronic lack of personnel, meaning there are less doctors and nurses and health professionals in the health care infrastructure of Swaziland, which makes nurses to attend on a daily basis an average of between 200 to 300 patients per doctor, per nurse, as well as per doctor, which makes life very hard for nurses. Coupled with that is a dilapidated health infrastructure, meaning the hospitals and clinics are generally old and poorly maintained, coupled and worsened by the lack of drugs and medical facilities. That Swaziland, notwithstanding the fact that it has a 26% HIV prevalence, which is one of the world leading rates in the world. But Swaziland's health infrastructure has been quite dilapidated, as I've just mentioned. but also the equipment. There is extreme shortage of your normal and basic equipment for doctors doctors and nurses to do their work efficiently. But worse, drugs. As per the briefing by the leadership of the nurses union, as I hinted earlier on, is at a situation where they do not have your basic drugs for chronic diseases, for various types of diseases. Now, worse when you speak about COVID-19. The president of the nurses union was saying to me, for instance, their biggest problem now is that they don't have the PPEs, which is the protective clothing that they would have to put on as they attend to the patients. They do not have literally the testing kits. Swaziland, beginning for the past 3 weeks, has been taking their testing things to South Africa for confirmation, because we didn't have a testing center or facility in the whole country. But last week, with the help of the so-called development partners, the government did make a call to say they have now put together a space where they now test locally. Which is a slight positive move in the sense that the testing now has improved, where they now would at least test between 50 and 100 people per day, unlike before where they were using South Africa, where they would literally test between 10 and 20 patients per day, which then says to us, yes.
But how have the international community reacted on this? You know, when the government of Swaziland are talking about development partners, it's normally Taiwan and the king that they mean is development partners.
That's a good question to throw, but a bad question to answer, in the sense that Swaziland has a couple of development partners through the bilateral relations that His Majesty has with, for instance, countries like America, Taiwan, South Africa, and a couple of other countries. You will appreciate, comrade, that the world is overwhelmed by the COVID-19 crisis, to a point that well-developed countries are struggling with their own situations, your Italy, your America and England and many others. Taiwan has not been of much help, unfortunately for us, in the sense that they themselves are clogged in their own crisis internally. The best they have done is to donate, I think they donated 3 million to the COVID-19 Swazi task team, which doesn't assist much, because you do not have the PPEs, as I have said, and you are actually struggling to even buy it, even if you did have the money. The Deputy Prime Minister, as late as last week, was responding to the nurses union and civil society calls to say, government is not providing protective clothing, is not providing testing kits, is not providing sanitizers, is not providing masks and gloves. And the Deputy Prime Minister, who is the chairperson of the COVID-19 Swazi task team, he was saying, show us where we must we buy these things. We have now mobilized about almost 100 million locally, but where are we going to buy it? Which is to show you that Taiwan is not equally helping to manufacture and give his development partners called Swaziland. But of interest, Comrade Morten and all of us, is that the king is missing, totally missing in action. He has literally not addressed the nation for a whole month. He has locked himself behind doors. He has locked his children. He has brought the best medical doctors and nurses to his own hospital, which is situated not very far from his palace, so that it attends to himself and his children, and is left in the dark.
Yeah.
And why the king would have helpful as the head of state and all prime ministers the world helping each other to say, for instance, a case if he was sensitive, he would have said, mobilized this amount. I can call the prime minister of Taiwan and say, Taiwan, can you manufacture your gloves, your ventilators, your PPE, and all other? Can you at least manufacture for us as well? We will pay you. That's where bilateral relations are important. Are showing up for
Wandile,
China as late as yes. Okay. I want China as late that day was into the ANC government in South Africa to give them assurance that they are with them in this fight and they do support them with us. That's global. But here, head of state is not doing that. The prime minister who has been appointed literally 4 or 5, and he was appointed last year. No global leader. He can't mobilize, he can't push or influence any kind.
Wandile? I think you lost Wandile there. Maybe you should log in again. Or is it me? No. I'm working. Hello. Yeah, I think we'll stop here.
Hello.
Yes, hello again, Wandile.
Hello.
Oh, you're back. You logged in again. Okay. So we just lost you when you talked about how the ANC in South Africa have reacted on this crisis.
Yes, I was on the point of the role of the head states across and seeing the benefit of bilateral relations that one country has with other. They are supporting each other and throwing their weight behind other. And the presidents are in constant, president and prime minister are in constant. And in fact, we do not see that. I was not spoken to the nation. It was the advent of COVID-19. Yes, there is no evidence that lobbying, aggressive lobbying, is more developed allies and friends who would have the capacity, for instance, to manufacture ventilators, masks, sanitizers, and the PPE, the protective gear for nurses and doctors. So now we are having that crisis where we are literally on our office, in the literal sense of the word. You have a government that is not able to meet the demand for over a month and 3 months to almost 4 months of COVID. Swaziland's government has only managed to test a literal less than 2,000 people in a population of 1.4 million. So the testing capacity is very poor. There are no protective gears. There is no political will on it. We are left in the dark with a headless and very useless prime minister and his cabinet. And worse, there is no medical doctor in the entire cabinet. There is no medical doctor in the entire task team who will at least give a scientific advice and the nation. You have a Minister of Health, appointed Minister of Health, who used to be a clerical officer. He knows nothing. The medical world has to be positioned to give the best scientific advice, update, and guidance.
So just Wandile, the last question here. For my side, it sounds very much like your government have no strategy. They're simply doing what everybody else is doing without knowing why to do it or why they're doing it. But what impact will this have for the fight for democracy or the struggle for democracy in Swaziland? I expect that this lockdown will not keep on forever. Are you ready after the lockdown to mobilize again?
Yeah, we should be in a position to do that, comrades. In fact, we are trying to figure out on ourselves what we think we can do. We have been shocked, frozen, but now we have a lot of information around the nature of the COVID. So we're trying to build a strategy on how ourselves, at least, we can respond to assist our own members, affiliates, the progressive community, and participants and doctors under the leader union. But also as well as big the population. We are looking forward to putting together something, a strategy as well as a campaign of some sort.
The sound is very bad, Wandile. I think we should end now.
Can you hear me now?
Yeah, I can hear you, but it's a very bad sound. You're falling out all the time, so we don't hear everything you're saying. But I think we have a clear picture of the situation in Swaziland now, and also what work you are doing for your members and your affiliates. And I will thank you for taking the time to talk to us about the situation in Swaziland, and we will of course stay in contact.
Thanks, comrade, for your time and interest, and we hope we will be in Denmark as well, and pass our regards to the rest of the Global Aktion comrades.
Yeah. So thanks, Wandile, and we stay in touch.
Okay. Thank you very much, comrade.